Imagine someone who can debate philosophy, write brilliant prose, and read a room with total fluency, but present them with even the simplest mathematical problem and everything stalls. They are completely number blind. Show them two groups of objects, say 8 over here and 6 over there, and they cannot instinctively tell which group is larger. To figure it out, they have to point and painfully count every single item. We usually treat math as the ultimate test of human intelligence. If you are smart, the assumption goes, you should be able to do the math. Yet neurologists have documented patients with exactly this deficit. The condition is called acalculia, or severe dyscalculia, and it stems from a highly specific variance or physical trauma in the brain. The ability to lose number sense while retaining full intellect identifies mathematics as a physical, localized biological machine running inside the human brain. To see how that machine works, we need to look inside a typical healthy brain. Deep inside the parietal lobe is a very specific fold of tissue called the intraparietal sulcus. Think of this as your body's dedicated number processor. Its baseline function is a biological reflex called subitizing. Subitizing is the ability to look at 1, 2, or 3 items and know the exact quantity instantly. You don't consciously count them. Your brain simply fires a signal of magnitude. It is an instinct so deeply embedded that infants and even many animals have it. But there is a hard limit to this reflex. Once you hit 4, 5, or 6 items, that instant visual recognition breaks down. The hardware maxes out, and you are forced into a slower, linear counting process. We are born pre-installed with this primal number sense. It operates completely outside of spoken language, long before we set foot in a classroom. A useful way to understand human cognition is to split it into hardware and software. The hardware is that physical tissue in the intraparietal sulcus, generating a raw biological feeling of magnitude. This image displays what the software looks like. Arabic numerals, mathematical vocabulary, and algorithms like long division. These are entirely cultural inventions layered on top of our biology. Without the underlying biological hardware to interpret the magnitude those squiggles represent, even the most elegant algebraic formulas are just empty symbols. This solves the mystery of our patient from earlier. Their cultural software, their general intelligence and ability to learn, is perfectly intact, but they are trying to book up a math program on a damaged piece of physical hardware. The highest achievements in human mathematics are essentially complex software upgrades running on a very ancient, very biological processor. For a lot of people, encountering math produces a cold sweat. Math anxiety is intensely common. In a traditional classroom, struggling with numbers is often framed as a lack of effort or a deficit in general intelligence. These neurobiological variances in hardware processing explain why some people struggle with magnitude, regardless of their overall intelligence or work ethic. Processing a number is much closer to perceiving the color blue or hearing a sudden change in pitch. It is an involuntary biological sense. Every time you quickly split a restaurant bill or instinctively gauge the distance of an oncoming car, that baseline calculator in your brain is humming away. Mathematics remains a fundamental biological instinct, a primal sense we are constantly discovering within ourselves.